Hi, my name is Andrew Evans, and in this video, I'm going to be talking about a book by Derek Bolton, which is called What is Mental Disorder? An Essay in Philosophy, Science, and Values. And this video is just going to focus on introduction and chapter 1 of that book. So, as the name implies, the topic of this book is the question, what is mental disorder? We can ask, what is a mental disorder? What makes something a mental disorder? We use this term a lot, but I don't think we often stop to think about what it means. And what's great about this book is it really digs into that question. What does it mean for some condition of the mind to be ordered or disordered? Sometimes we use the term mental illness, and the term mental disorder is primarily used in this book, but it's a similar term, right? It's referring roughly to the same thing. Um, so that's what we're going to start to dive into here in this video. Now, in the introduction to the book, Bolton indicates that there are two major questions that he wants to address in this book. The first question is, are the norms in psychiatry really medical or are they really social? And the second question is, what is the validity of the distinction between mental disorder and order, between abnormal and normal mental functioning? So let's break these down a little bit. The first question, are the norms in psychiatry really medical or are they really social? So there's a lot to this question, right? We can look at this word norms as being really important to the question. Um, what do we mean by norms? And he's clearly asking, he clearly thinks that the mental health field has norms, that there are norms in calling a condition mentally disordered. But are these medical norms or are they actually social norms? What does he mean by medical and what does he mean by social? So these are things that will be explored. Roughly, right now, we can kind of say that by medical norms, he means norms of science or of biology, right? Something that is scientific in nature. Social norms are more things that are agreed upon by a society, something that we might decide as a society that might change between different societies, right? So he wants to know if the norms around mental health care are really scientific in nature or if they're closer to social practices. And then this second question is about the distinction between mental disorder and order. Is there a real distinction between mental disorder and mental order? Is there something that is, are there conditions of the mind that are ordered and conditions of the mind that are disordered? And similar, he connects this to the question of mental functioning. What's the distinction, or is there a distinction between normal and abnormal mental functioning? So, a lot of these words need to be defined, right? We need to really unpack, what do we mean by mental disorder? What do we mean by normal? What do we mean by functioning? And that's kind of what the book is all about, is unpacking some of these terms and trying to figure out, what we're after in the field of mental health care. Okay, moving on to chapter 1. Chapter 1 focuses on the diagnostic manuals that the mental health system uses to classify certain conditions as mental disorders. So, the field of psychiatry, but also other mental health fields like clinical psychology, mental health counseling, social work, psychiatric nursing, etc., they use diagnostic systems or manuals in order to diagnose people with mental disorders. Or, we might use a different term, psychiatric conditions or something like that. There are a variety of manuals of mental disorders that are different from one another, but there are some that are used more than others, right? And the primary ones that Bolton talks about are the Diagnostic and Statistical Manual of Mental Disorder, which comes from the American Psychiatric Association. So that's often referred to as the DSM. And the International Classification of Diseases, they have so that is a book of all diseases from the World Health Organization, and they have a section on mental health conditions. So that's often referred to as the ICD. These are used the most. These are the most powerful manuals out there. Especially in the United States, the DSM is pretty much what mental health professionals are going to use to diagnose people with mental disorders. And that's because the insurance companies and scientific world, everything in the mental health field is sort of wrapped around, for better or for worse, the DSM. And so that's what we're going to focus on in this video, is primarily the DSM. And here on this slide, I have all the different DSMs. There has been a variety of additions. So it started back in the 1950s with the DSM-1, you can see in the top left corner. And now just this year, the DSM-5 TR came out. So there's been all in all 5 editions, but there's also been some revisions to editions. So we have 8 different books here that list the mental disorders according to the American Psychiatric Association. And this is what clinicians are using. This is what psychiatrists and therapists and counselors are using to diagnose people with mental disorders in the United States. So Bolton really focuses on this manual and some of the questions and issues and goals of this manual in chapter 1. Bolton explains that the DSM is a clinical tool, right? Clinicians are supposed to be able to interview a client and then diagnose them with a mental disorder from the DSM. We should also note that the DSM has also been used for research purposes, though. So, for example, if I want to do a study on depression, I would have to define what I mean by depression, and I would probably have to use one of the diagnostic criteria from the DSM of the depressive disorders. So, like major depressive disorder or persistent depressive disorder or something like that. Um, the point being that it's not just a diagnostic tool, it's also used as the basis for mental health research in a lot of ways. So, in this chapter, Bolton really focuses on how the DSM relates to each of these following concepts: normativity, reliability, and validity. So, I'm going to briefly just go over what these concepts mean, how they relate to the mental health field. And then towards the end here, we're going to return to the question, what is mental disorder, and kind of put forward the first possible answer to that question. Okay, normativity. So the first thing I want to note is the terms normativity, norms, and normal, they're all related to each other, right? So we can think of a norm as some standard, right? Some way that something could be, right? So you can either meet the standard, you can either meet the norm, or you can fail to meet the norm. Or maybe you can go above the norm, right? But it's some standard. Normativity then just means something relating to norms, right? And normal is related to these terms. Normal can either mean meeting that standard, right? If you meet that standard, you are normal. If something meets a standard, it's normal. Or common, right? Statistically normal, right? It's what, if something is normal in that sense, it just means it's how things usually are, right? It's not something that's rare, it's common. Similarly, abnormal can mean out of the ordinary, or it might mean not meeting some standard, right? Failing to meet some standard. Or maybe going beyond the standard to the point where it's no longer normal. So we can think of normativity ultimately as being about norms, being about standards, and whether or not something is meeting a standard. So, for example, we can look at this strawberry, right? And we can probably agree this isn't a normal strawberry. And we might mean that in different ways. We might say that it's not normal in that it doesn't meet the standard of what a strawberry, quote unquote, should look like. There might be some standard that we have in our mind of what a strawberry looks like, and this strawberry doesn't look like that. It actually looks more like a bird, right? We can also mean normal in the sense of common. So this strawberry isn't common. Most strawberries don't look like this, and it's rare. So in that way, it's an abnormal strawberry, but in the sense of it being uncommon. So how does this relate to mental health? Well, let's take this person as an example, and suppose this person is feeling very sad, right? Extreme sadness. Now, we can ask the question, is this condition that this person is experiencing normal, right? Does it meet some norm or not? And we might mean different things by that. One thing we could mean is, okay, what is the standard? How, quote unquote, should people behave? And is this person meeting that standard? Or is their sadness falling below some threshold of functioning? But we also might just mean it statistically, right? Is this person's sadness rare? Are most people much happier than this person, and their sadness is sort of an outlier, right? So when we ask about norms or normality or normal in mental health care, we kind of have these sorts of questions in mind. And this relates back to the DSM because the DSM clearly is interested in norms, but going back to this first question of the book, are these norms scientific norms or are they social norms, right? This is a question that Bolton is exploring. So let's take a step back and just think for a few minutes. What comes to mind when you think of the words normal and abnormal? So I just want you to stop for a minute, maybe pause the video, and just think, what other words, what other concepts are coming up when you think of the word abnormal and when you think of the word normal? And similarly, but a little different, what are some words that roughly mean the same thing as normal, right? So maybe pause the video for a few seconds and just think about similar words to the word normal. And maybe some words you were able to come up with were things like functioning or average, right? And I think that speaks to the different senses we might mean normal and how questions of functioning, they're actually going to become pretty relevant here in the book. Okay, so reliability and validity. Reliability, in this sense, in this context, is the extent to which multiple measurements or clinicians can look at the same instance of a condition and diagnose it in the same way. Validity is the extent to which an instrument accurately assesses what it sets out to measure. Okay, so let's apply this. Going back to this person that's feeling extreme sadness, we might say that there's reliable diagnosis happening if multiple clinicians come to the same conclusion. So suppose this therapist on the left and this psychiatrist on the right are both able to interview this same person. And if they both agree that this person has, say, major depressive disorder, then there's some reliability present there, right? Different, in this case, clinicians are able to assess the same person and the same condition within a person and come to the same conclusion. That makes it reliable. And the DSM is ultimately going after reliability. When it has conditions in the manual, it wants different clinicians to be able to diagnose people in the same way using the categories in the DSM. So it really wants, psychiatrist A and therapist B to interact with the same person and come to the same conclusion. This person has generalized anxiety disorder, or this person has schizophrenia, right? That's a goal of the DSM. Now, another goal of the DSM, and well, actually, Bolton kind of questions to what extent this is a goal and to what extent the DSM succeeds or fails in this, is to be a valid measure. So again, remember, validity means the extent to which an instrument accurately assesses what it sets out to measure. So validity in this case means, do the descriptions in the DSM actually match the thing in the world? So in this case, right, suppose we might think that this person has major depressive disorder. So we would have to look at the condition, major depressive disorder in the DSM, and see, does it actually correspond to this person's condition? Is there something in the world that is major depressive disorder, and the DSM category picks out that thing? So while reliability is about different clinicians being able to reliably diagnose things in the same way, validity is more about accuracy. Is the depression that's described in the DSM actually the experiences of people in the world? Are these mental disorders real categories in the world? Is this person's depression represented in the manual? So Bolton is sort of wondering to what extent the DSM is able to achieve validity. Reliability seemed to have been more of its main goal, especially if you look back at the history of the DSM and how it's changed over time. So again, these are the concepts that Bolton sort of goes over in this chapter: normativity, reliability, and validity, and how they all relate to the DSM. Now we can return to this main question: what is mental disorder? And this is the main question of the book. And Bolton considers one possibility here in the introduction. He sort of previews some of the other possibilities that he talks about in later chapters. So what he introduces is the DSM's definition of mental disorder. So, well, this book was written in 2008. So Bolton actually uses the DSM-4 throughout the course of the book. And there have been a few updates to the DSM since then. I'm going to focus on the DSM-5, but there's actually already been an update since then. The DSM-5 came out in 2013. The DSM-5 TR came out in 2022. So we're going to look at because it's more updated, but it's not the most updated one. We're going to look at the DSM-5 definition of mental disorder, because that's what I have access to, and consider this as one possibility for answering the question, what is mental disorder? Okay, I'm just going to quickly read it. Quote, "A mental disorder is a syndrome characterized by clinically significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities. An expectable or culturally approved response to a common stressor or loss, such as the death of a loved one, is not a mental disorder. Socially deviant behavior in conflicts that are primarily between the individual and society are not mental disorders unless the deviance or conflicts results from a dysfunction in the individual as described above." So this is quite a wordy definition. There's a lot going on here, and I tried to highlight in orange some of the most significant concepts that this definition brings up. The main thing I want us to take away from this definition is that the DSM is saying that mental disorders are a dysfunction of some sort, right? There is a dysfunction in the mind, right? So we see this in the words in this part here: reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. So it's pointing out that there is some dysfunction, and that dysfunction is clinically significant, right? So what that exactly means isn't defined, but clinically significant, usually refers to there's something about it that's rises to the level of needing or could use medical attention, right? So it points out dysfunction. Dysfunction is one major aspect of this definition. But it also says that mental disorders are usually associated with significant distress or disability. So we can think of these as harms, right? So the DSM definition of mental disorder is saying both that mental disorders are dysfunctional in some way and that they're harmful also. They involve significant distress or disability. Now, the last bit of the definition kind of excludes some things. So if something is expectable or a culturally approved response, that's not a mental disorder. If something's just a socially deviant behavior or a conflict that's primarily between an individual and society, that's not a mental disorder. So it's trying to really like carve out a space for what mental disorders are. They're these clinically significant mental dysfunctions that are also harmful. They usually cause distress and disability. Bolton returns to this definition and considers it thoroughly throughout the course of the book. So for now, I just want to note that this is one possibility for answering the question, what is mental disorder? This is the answer that the DSM gives. Okay, and then Bolton also sort of previews some other possibilities. Or so the thing about the DSM definition is it doesn't really say what it means by dysfunction, right? Or what, if we can think of dysfunction and disorder as similar terms, which may or may not be the case, what does it actually mean for something to be dysfunctional or disordered, right? So some other definitions of disorder kind of get into this and give a more thorough explanation of what we mean by dysfunction. And these are some theories that in various ways Bolton considers throughout the rest of the book. So if we're zeroing in on this distressing, impairing psychological conditions, right? How are they disordered? So he considers these four possibilities. It might be a breakdown of meaningful connections, right? Maybe the mental state or the behavioral doesn't make sense, it's pointless, it's random. It might be that there's some sort of lesion or underlying biological problem. Could be that functioning statistically abnormal, and it could be that functioning involves some sort of evolutionary dysfunction. So the mind isn't functioning the way evolution designed it to. But he also points out some problems for each of these possible theories of disorder. Each of them seem to have alternative explanations. So this is sort of just a preview. These are some of the things that Bolton will get into later in the book when he starts talking about theories of Christopher Borst, the theories of Jerome Wakefield, and a variety of other thinkers. All right, well, that is all I have for that video, and thank you for watching.